Cough, cold and fever. These are the three very common complaints in a pediatric age group. And if not treated properly on time with proper guideline, it may turn into a disastrous situation called as pneumonia. I am Dr. Kalpesh Patil, Pediatric and Neonatal Laparoscopic Surgeon, owner of Dr. Kalpesh Chair of Child Clinic, Pune. What is pneumonia? While dealing with the babies, when we are growing babies, usually they suffer from these three basic symptoms called cough, cold and fever, for which your visits to a pediatrician are frequent. But if you do not attend those sign symptoms significantly, then it may lead to a disastrous situation called as pneumonia. What is pneumonia? It is a lung infection. Means the bacterial colonization starts settling down into lung parenchyma itself. What happens if you neglect such symptoms? Baby will present with respiratory distress, difficulty in breathing, and he may require oxygen support. Because if the infection is flaring up into his lung tissues, then oxygen level will go down. Simultaneously, he may require intensive care unit for his further care. What is the treatment for pneumonia? How it is to be diagnosed? Pneumonia is usually diagnosed on simple chest X-ray. So a radiograph picture of a chest can diagnose a white patch seen in the lung. But if you want the further detailed study of the lung, then even the thoracic CT scan images can also give you the detailed study for the pneumonia. Pneumonia is classified as per the zone involved in the lung, the severity of the disease, the bacterial colonization which is causing the pneumonia, and it is classified and treated accordingly and aggressively. What is the treatment for pneumonia? Is antibiotic. So antibiotic prophylaxis with proper guidance under vision, either oral supplements, and if there is a persistent fever presentation, tachypnea, not able to maintain the oxygen saturation, then in those scenario you might require intensive care unit admissions and intravenous antibiotics to be given. Blood culture will give you the exact bacterial cause which is causing the pneumonia, and accordingly you can start the antibiotic. What happens if you neglect pneumonia? The future of neglected pneumonia may be the fluid collection around the lung into the thorax, that is called as pleural effusion. So pleural effusion is an early step of neglected pneumonia. What is to be done with the pleural effusion? Sometimes on the sonography or on CT scan, if the volume of the pleural effusion is very less, not compressing the lung, and it is in liquid format, then it can be tapped by needle, or it can be aspirated with the help of needle, and USG or CT scan can help you to insert the needle at proper location. So USG guided or CT guided needle aspiration of the pleural fluid is one basic treatment. If the volume of the fluid is high and which is causing the displacement or compression over the lung and displacement of the pericardium, then in that scenario you may require intercostal tube which will drain the fluid from the thoracic cavity, release the lung, and will help to shift the mediastinum into its normal anatomical position. But in long-standing pneumonias, or there are certain bacterial infection where the severe form of the pneumonia which may present with the involvement of both sides of the lungs, or unilateral rapid aggressive involvement of the lung is seen, in those scenario this pleural effusion may get converted into infectious presentation called as empyema thoracis. And empyemothoracis means it is the collection or conversion of the pleural effusion into pus. So it is a thick fluid or it is a formed pus with a necrotic underlying lung. In this scenario, neither the intercostal drainage tube is going to work to relieve the pressure over the lung and to help the lung to get inflated normally. So in this scenario, you might have to surgically intervene. In early stages of the pneumonia, when there is a pleural effusion just started getting infected or just started getting thickened up on the sonography, which may present with the presentation of multiple septi on the sonography. In this scenario, we can go ahead with intervention of VATS. VATS is a short form for video assisted thoracic surgery. With the help of VATS, we can insert a telescope through hardly 3 or 5 millimeter incision into the thorax, and with 2 another puncture wounds, we can clean and decorticate the part of the damaged pleura and the fluid from the thoracic cavity and put an intercostal drainage tube inside. But sometimes if the pleura is so thick or the pus is so thick and lung is severely necrosed, then the video assisted thoracic surgery may not help and you might have to go ahead with the surgical intervention called as open thoracotomy and decortication of the lung. In open thoracotomy and decortication of the lung, we open the thorax properly and under vision we clean the whole pus from the thoracic cavity. We remove or excise sometimes the necrosed part of the lung and we reconfirm on table the complete inflation of the damaged lung. After putting the intercostal drainage tube, the thoracic cavity is closed. So pneumonia in pediatric age group is to be taken very seriously, is to be treated very aggressively, and if you are in dilemma, you should be consulting your nearby pediatrician or pediatric surgeon as early as possible and take their guidance. For further information, you can contact our website or call the number flashing down below. Thank you.